Good evening, students, family, friends, and faculty. Welcome to our clinical transition to care ceremony. Tonight, we are gathered here to celebrate a significant milestone in the nursing student education. In just about 2 weeks, 14 short days, you will be finding yourselves in the virtual clinical setting. How exciting to be in your shoes. In NR 224 and NR 302, you attended lectures to gain foundational knowledge, and you attended virtual labs to learn and how to practice your skills. Now is your chance to employ those new skills and master them with real-life virtual patients. Patients who are no longer faceless in a textbook, but a unique individual with a family, hope, fears, clinical and psychosocial needs, and a story to tell. This evening, we will hear from President Snow and representatives of the faculty. Additionally, you will hear from a fellow Chamberlain student who was just in your seat a short year ago. We have witnessed your passion and dedication to building the foundation of your nursing practice, and through it, it was not always easy, and the challenges will continue. However, I can promise you one thing: the frustrations and sacrifices and trials are worth it in the end. So on this night, we congratulate you, we celebrate you, and we honor you. May you continue to demonstrate the grit and tenacity required to be successful in this program, the nursing profession and life. Thank you.
Good evening. I'm Jan Snow, the president of the Addison campus. Today we celebrate your transition to patient care. You're completing your first fundamentals course this week and moving to patient care. It'll be slightly different for you, though, because your first experience will be in a simulated environment. This has been quite the year, hasn't it? It's the year of the nurse, but I'm sure our memories of 2020 will be focused on how we all survived the year of the nurse, right? Being away from everything that gave our lives meaning, our friends, the school, our typical routine. We've learned so much about ourselves and about our capabilities and endurance under pressure. Nursing is a calling. You are entering a sacred profession which requires only the best from all of you. Nothing but the best is acceptable. While you won't be in a clinical with patients in July, you will most likely be in September. You will see and hear things from your patients that you've never heard from another human being. As a nurse, human beings will entrust their lives to you. Remember, the profession of nursing has been, for more than 20 years, the most trusted profession as ranked by the U.S. population. A few short months ago, when you entered Chamberlain, you filled out an application. We call it a passion statement, where you told us why you wanted to be a nurse. And most of you said that you wanted to help others. Many of you said you wanted to change the world. I would like to challenge you today to take on a new attitude, one that is needed in the profession of nursing today. And that attitude is one of caring. Caring for your fellow students, caring for your instructors, and of course, for your patients. That attitude is embodied in what we call Chamberlain Care. That suggests that you care for yourself first so that you are at your best to take care of your fellow nurses and your patients. I listened to the NR 103 presentations this week. You remember doing those reflection sessions just a semester ago. Many of you said that you were inspired by a family member or had your own experience with the healthcare system. I want you to remember what brought you to nursing. I'm sure That's still fresh in your mind, but you need to keep it fresh in your mind for the time that you're in this program. There will be rough spots, and you want to look back and say, why did I want to become a nurse? So, just a few things that I want to mention, a few words of advice, if you will, a few pearls of wisdom. Number one, when you're in clinical, give 100%. Show up, don't just get by. You're taking care of patients. Resist opportunities to look for shortcuts. There's not an easy way to become a nurse, whether through Chamberlain or through any other nursing school in this country. Take advantage of opportunities when they arise. Look for opportunities in your clinical practice that expose you to new things. Follow your preceptor, your nurse, down the hall. Ask for opportunities. Be humble. Your instructors are there to teach. Be open to what they have to say. They're coming from a place of experience as a nurse. Many of you have experiences as CNAs, as paramedics, and so on, but not as a nurse. Be respectful. Be respectful to your fellow students, to your instructors, to the nurses that you're working with. Remember, not every nurse is going to be having a good day and want to work with students. We hear that often, but be patient with them. Be a team player. Nursing is a team sport. I always say that. You're working with others, and others are going to help you. We're all looking for our teams to help us every day. And remember, first and foremost, the patient is the most important element of your profession, of our profession. It's not just a job to be a patient advocate. It's really your duty as a nurse. Leave your personal baggage outside of the clinical setting and be there to serve in a compassionate way. Sure, there are additional things that I could add, but we have a number of other folks with us today that are going to add their take on pearls of wisdom for you as you start your clinical practice. It's really time for you to spread your wings and fly. I suspect that it won't be easy for all of you. There will be crash landings along the way. What you have to realize is that that's the journey of becoming a nurse. You have to get up and keep going. You have lots of support at Chamberlain from your faculty, from your student learning specialists, from your advisors. We'll be checking in with you along the way. And in a few short years, you're going to be graduating and emerging from the cocoon of Chamberlain University as you embark on your professional career. I suspect you'll look back about how you felt today, and we'll see the great progress that you will have made in the next 1.5 to 2 years. Congratulations and best wishes on your journey.
Good evening, future nurses. That's crazy to hear, isn't it? Future nurse. Let that sink in for a moment. During these unprecedented times that the world is currently facing, you have made the choice to join one of the most selfless careers. I am honored to be here today as your student speaker and to share this special moment with you and your loved ones. Exactly 1 year ago, I was attending my transition to care ceremony. Given the current circumstances, I am here virtually to tell you how proud I am to have you as my classmates. The class Fundamentals is given that name for a reason. This will be your foundation as a nursing student. The skills that you have acquired are ones that you will apply during your entire nursing career. I admire you all for sticking throughout this difficult time and continuing your education. The amount of strength and courage you have all displayed is amazing. As an upperclassman, I feel as though it is my duty to pass down any words of wisdom I have collected throughout my time at Chamberlain. First and foremost, thank the people who have supported you throughout your nursing journey thus far. Whether they are near or far due to COVID-19, I want you to give them the elbow bump that seems to have replaced a traditional hug. Your supporters are the ones who will help you get through nursing school. They are the ones who will keep you going even when you feel like giving up. Second, make friends in nursing school. I can't stress this enough. No one else will understand the amount of stress that you are going through except your classmates. The friends that I made when I was sitting at my transition to care ceremony are some of my closest friends today. We study together, we stress eat together, and most importantly, we're there for one another. I won't be the last person who will tell you how difficult nursing school is. Take your time here seriously, but don't forget to celebrate your accomplishments along the way. Third, make the best out of your future clinicals. Whether they be online or in person, don't hesitate to ask questions and get involved. I've always been told that you can catch more bees with honey than you can with vinegar. Never forget to maintain the same professionalism that Chamberlain has instilled in us since our first day. You never know who will be interviewing you someday when you pass your NCLEX. You will always want to be remembered as a smart, respectful, and hardworking student. Lastly, don't let your past define the student that you wish to be at Chamberlain. I could sit here and tell you all about how Walt Disney and Michael Jordan failed and became successful people in the world. But to be honest with you all, I failed out of my freshman year of college before entering nursing school. I got pregnant when I was 19 years old. I worked several jobs, but I wanted to make sure that I didn't end up being another statistic. Here I am as a mother, a wife, a fellow classmate of yours, and as your student government president to tell you that failure is okay. After failure comes growth, and if I didn't fail in life, I wouldn't be where I am today. If I've learned anything during this pandemic, it is that adaptability is a person's best trait. As a nurse, you should be able to adapt to any situation that you are presented with. I know that these circumstances aren't ideal, but please understand that you will all make amazing nurses someday. Please remember that you started this journey for a reason, and let that reason be the driving force that pushes you to succeed every single day. Thank you and good luck this session.
Clinical learning takes place in a variety of patient care environments where the opportunity to transfer, integrate, and apply classroom knowledge transpires. We are here to celebrate the first group of students who have successfully completed the skills-based portion of their fundamentals course virtually. My name is Victoria Muka, nursing instructor from our Chamberlain Addison campus with a faculty perspective on the transition to care. It's time to take what you have learned and put it into practice during your first clinical as a Chamberlain College of Nursing student nurse. It is certainly a cause to celebrate. Although the celebration is taking on a different form, it continues to be a time-honored tradition at our Addison campus to welcome you into your first clinical. Each class cohort brings new successes and challenges to our nursing program. All your faculty, support staff, and administration continue to learn alongside you in ways we could not have previously imagined. We are proud of the relationships we have developed with you and are looking to continue to grow together in an atmosphere of encouragement and support, with Chamberlain care to guide us, as we have done with the extraordinary Chamberlain nurses that have gone before you. The virtual environment will provide many of the same opportunities to practice your knowledge and skills. At the very beginning of this semester, you were introduced to the critical thinking attitudes and applications to nursing practice, Potter and Perry, Table 15-3. You now know these as a combination of newly acquired knowledge, inference, and just a little therapeutic communication thrown in for good measure. The critical thinking attitudes of the nursing student are the same as those of the professional nurse. Use these to guide your thoughts and actions in the clinical environment. These are your superpowers, and there have been a team of people here helping you to acquire them. Our learning specialists in the CAS and lab, our student service advisors, our career services team, our clinical coordinators, all your fundamentals faculty, and our Addison campus administration are all committed to your success. These attitudes and their application have a positive effect on our thinking, learning, and success. As you progress through the program, you will continue to draw on these superpowers. You will soon see that they translate into the virtual nursing environment of your first clinical as easily as they do on campus or any clinical site. We want you to go into your clinical rotation with confidence. You have learned how to introduce yourself to a patient. In the clinical environment, speak with conviction when you begin a new procedure. Do not lead a patient to think you are unable to perform care safely. Be well prepared, and always encourage a patient to ask questions. In a clinical environment, we are going to encourage you to share ideas with your peers and your nursing instructors, especially when there are different views on the same subjects. Sharing ideas about nursing interventions and evidence-based practice demonstrates your ability to think independently. Nurses apply fairness when we listen to both sides of the story before making judgments. Keep fairness in mind when team members experience challenges. It will be very important to ask for help whenever you need it, especially if you are uncertain about how to perform a nursing skill or intervention. Report any concerns immediately to your clinical instructor and demonstrate responsibility by following standards of practice in your care. If your knowledge causes you to question the healthcare provider order, do so. Be willing to recommend alternative approaches to nursing care when colleagues are having little success with patients. The opportunity to step out of your comfort zone in a clinical setting under the guidance of your instructors is really important. Learning to identify risk is especially important because in healthcare, nurses strive to decrease risks to patients. Critical thinkers are determined to find effective solutions to patient care problems. A critical thinker who perseveres is not satisfied with minimal effort, but works to achieve the highest levels of quality care. I think that we can all agree that this semester the superpower of creativity was never more necessary. Creativity does not always come easy, but your faculty can say it was never more evident than during the video recordings of your skills this semester. Creativity involves original thinking. This means that you very effectively found solutions outside the box. Creativity motivated you to think of options and unique approaches to your return demonstrations. Moving forward in the clinical setting, each week find something that makes you curious. Having a sense of curiosity, asking yourself why or what if, can be a strong motivating factor when patient care becomes complex. The use of your personal integrity as a nurse builds trust with your coworkers, peers, and patients. Nurses face many dilemmas and problems in everyday clinical practice. The person of integrity is honest and willing to admit mistakes. The clinical environment is the perfect place to practice this superpower. We know that you will all continue to act with integrity, which has become so important in our virtual environment.
Nurses, please extend your arms up with your palms facing up. Blessed be these hands that touch life. Blessed be these hands that have felt pain. Blessed be these hands that have embraced compassion. Blessed be these hands that have been clenched with anger or withdrawn in fear. Blessed be these hands that have drawn blood and administered medicine. Blessed be these hands that have cleaned beds and disposed of waste. Blessed be these hands that have anointed the sick and offered blessing. Blessed be these hands that have grown stiff with age. Blessed be these hands that have comforted the dying and held the dead. Blessed be these hands, we hold the future in these hands.
I pledge in the presence of this assembly to practice my profession faithfully. I will do all in my power to maintain and elevate the standard of my profession, and I will hold in confidence all personal matters committed to my keeping, and all family affairs coming to my knowledge in the practice of my profession. I will devote myself to the welfare of those committed to my care. Thank you, future Chamberlain nurses. Good luck and Godspeed.
That concludes our ceremony for this evening. I'm glad that you were virtual, of course, but my hope is that you'll share this ceremony with your families, your friends, significant others. It's truly a milestone to have gotten through many of your gen ed courses, your science courses, and here you are beginning on the real journey of nursing, where you're going to be taking care of patients. I wanted to point out just a couple of things as you viewed the photos of our students that are in our fundamentals course. I hope you notice the great diversity that is part of Chamberlain University. We have a lot of diversity on our campus, which really enriches our teaching and hopefully your learning. We have a lot of male nursing students, right? You saw a lot of males in the class, which I think we have something like 15% of our population of students here are male students, which is almost unheard of. Most schools have 1 to 2%. So we're really proud to have that diverse of a group. The other thing, and this would have been in the program that you would be receiving, and you're not getting a program for the virtual ceremony, but I did want to touch on one thing. Typically, as you experience the transition to care ceremony, we give you a white daisy. And we talk about that white daisy, the significance of that, and what it means for you. Chamberlain is one of the members of the Daisy Foundation. That is something that was started in 1999. It was a family who had a son who passed away from an immune disorder. And the family, as they reflected on their experience, noted that their nurses were the most helpful and the best part of this awful journey that they went through with their son. So they started the Daisy Foundation, and many hospitals now have a Daisy Award, and it's a pretty significant award that are given a couple times a year to a nurse that exemplifies true caring and truly a compassionate nurse. They now have a Daisy in Training Award. We just had a Daisy in Training Award winner, and as you come back to campus, you'll see her name in the lobby by Celine's desk there, noting that milestone for her. So we will be awarding another Daisy Award later in the year, but just wanted to call your attention to that. So thank you again, everyone, for being part of this important ceremony. There'll be many more ceremonies along the way, but Congratulations on reaching this point, and we look forward absolutely to seeing you back on campus and being a part of that journey with you. Thank you.